All right, good evening. If you are just joining, you're welcome. So let's begin our discussion tonight. Tonight is episode 5 of our new season. Right. So in this episode, we're going to be discussing, rather, we're going to be answering why regular sex and yet no pregnancy. You have regular sex, no pregnancy. Why? Can that happen? If it happens, why does it happen? So that is the discussion tonight. Right? There are people who will say, but we are doing everything right. As far as conception is concerned, as far as fertility is as far as conceiving is concerned, we are doing everything right. So why are we not pregnant? And if doing everything right, they mean that to say we are having regular sex, we don't use protection. Benedict, Happy New Year, good to see you. We don't use protection and doing everything right, months and years has passed, and yet pregnancy has refused to come. Still no pregnancy. Why? Why is this so? You see, this situation confuses couples more than any infertility diagnosis. The reason is because on the surface, everything seems right. You will not blame them, right? Hmm? Fertility is about accuracy, biology, and timing. That's what fertility is all about. Regular sex is effort. You're putting effort, which is good, but it's not a guarantee that you'll be pregnant. Is that okay? So first, let's look at what does regular sex actually mean. What does it mean? Right? For most couple, regular sex would mean a few times a week, because regular is a subjective word. Everybody have their definition of regular. So for some people, a few times a week is regular to them. For some others, mostly weekends is regular to them. For some others, whenever both partners are free, that is what they call regular. While some others, they just have sex without tracking ovulation. Right? So, but I'll tell you, but biologically speaking, these what we just mentioned, they may or may not overlap with your fertile window. And one of the things you must know is fertile window. If you don't know anything about fertile window, just go to the comment section. Say, tell me. Then we'll go into the gist, right? But I must tell you quickly that pregnancy does not respond to frequency alone. It does not respond to frequency. It responds to precision, because biology works with precision, right? All right, Cece wants to know what fertile window is. Cece, I want to shock you. Yeah. Do you know that fertile window is smaller than most people think it is? They think it's anytime you have sex, therefore you should be pregnant. No, there's something called fertile window, right? And fertile window is about 5 days before ovulation, plus the ovulation day proper. So 5 days before ovulation plus ovulation, that you have 6 days of fertile window. Comprehend? Right. That's what fertile window is. Fertile window is 6 days, fertile days in your entire cycle. Think of your 35 days cycle duration. Of that 35 days of cycle, only 6 days is your fertile window. If you have 21 days of cycle, only 6 days is your fertile window. And of course, please go to the previous videos. I talked about the same thing, right? So what I'm doing today is just to add to what I've already said. So to catch up quickly, just go straight to YouTube, search my name, Dr. Godwin EMB, and you catch up, right? You can use the weekend because I don't live stream on weekend. All right. So I said you have 6 days in your cycle, which is your fertile window. The probability of pregnancy outside these 6 days fertile window is 0. The probability that you will conceive outside these 6 days of fertile window is 0, unless you encounter someone that has super sperm, right? And now that's a new word I just introduced, because yes, there is something called super sperm, but I'm not going to go into that tonight. There's something called super sperm. We would maybe one of these days I'll talk about it, right? But I said that to say that the probability of conceiving outside your 6 days fertile window is almost 0. If you're just joining, you're welcome. Please make sure you're tapping on your screen. We have our flash goal, 3 heart me's. By the way, if you have not dropped a heart me yet, this is the time. And if you're seeing me for the first time, make sure you're following me. All right. So that is the first thing. The probability of conceiving outside your fertile window is almost 0. The highest conception rate occurs 1 to 2 days before the ovulation day. The highest chance at conception happens 1 to 2 days before. That is, if when you have intercourse, 1 or 2 days before the ovulation day. That is the highest chance you have at conception, right? You know, many couples unknowingly have sex after ovulation. That's why you see I have problem with those people that are doing long distance relationship. You say, okay, my ovulation will be tomorrow, therefore I want to start traveling to go and see my partner wherever he is. More likely you guys may even have the intercourse after the ovulation. So that your strategy is not going to work. Many couples unknowingly have sex after ovulation when the chance of conception is gone. And they've been like that for years now. And they're wondering what is really going on. Why are we not conceive? You see the reason why I said in the first episode, the second episode, I said, don't pack your bags yet. The challenge you have with fertility is knowledge. And I'm bringing you that knowledge tonight so that you will worry no more. So yes, regular sex can still completely miss the opportunity because you're just knocking outside the penalty, right? So up until this point, if you understood anything, just type understood in the comment section. Then let us begin to answer the question. Exactly. That hope without result is enjoyment anyway. So regardless. So let's begin to give the reasons why you can have regular sex and pregnancy still will not happen. Who is ready for the reasons? Let's start giving the reasons. Who is ready? All right. Who is ready? I would to God many people who are trying to conceive will come on this life, because many of them, their problem is just knowledge. Darling, good to see you. Good to see you, darling. Right? Good evening, you're welcome. Many of those people that are trying to conceive, my TTC people, many of them are suffering from lack of knowledge. There's really, I will always tell you, like they will say with my full chest, right? I always tell you, many people that are trying to conceive today are actually suffering from lack of knowledge. Not that something is really wrong. And that ignorance led them to waste their time until age catch up with them. We are going to cure that ignorance this year. This year. You know, they said something that there is overpopulation in the world. I don't think it's true. How can there be overpopulation in the world and you have not have your own baby? Contribute your own to the number before you agree there is overpopulation. All right. All right. So let's now begin to give reasons. Right? Why regular sex and no pregnancy? Reason number one. Reason number one. The first reason is ovulation is not happening, even with regular periods. Yes, you can have regular periods, but you're not ovulating. Yeah. And of course, again, the reverse, you can also have the reverse. You can be ovulating and not be menstruating. Right? So that one is even better for you to be ovulating and you're not, because you can still be pregnant and have children. But when you don't ovulate, when you don't, that is your problem, really. We will cure that problem, right? We will cure it. Right? So if you are seeing menstruation regularly but no ovulation, that's where the problem is, because you need to ovulate for pregnancy to occur. Is that okay? And now this surprised many people, actually. It surprised many people. How could you have menstrual bleeding and no ovulation? You need to wonder, how come? How come? There are conditions that can cause that. There are conditions that can cause that. And by the way, if you are not writing, you miss me here. You miss too much. Anyway, you still have the videos on YouTube, so you can always go and watch it, right? Is that okay? So let's talk about the conditions that can be responsible for menstrual period without ovulation. Are you ready? The first thing, the notorious PCOS. And by the way, if you are, excuse me, just go to my videos. I've done some things on PCOS already, some videos, just 1 minute video on PCOS. Go to my profile. You'll see those and listen to it over and over again so that you understand what's going on. Is that okay? So the first notorious cause is PCOS. PCOS. Hello, Sunflower. What happened to you yesterday? Network threw you away. All right? You're welcome. PCOS. Yes, you can see menstruation, but no ovulation. PCOS is number one cause. There are those with thyroid disorders. Thyroid disorders. Now, if you don't know what I'm talking about, don't worry, your doctor knows. But just to help you to give you an idea, there is an organ here, right? They call that organ the thyroid gland. And that is responsible for a few things like metabolism and fertility concerns, right? So where there is thyroid disorder, you could have this challenge. That's why your doctor will send you for thyroid hormone test and stuff, right? Number 3 condition is hyperprolactinemia, when the prolactin is high, right? Hyperprolactinemia. The number 4 is stress-related hypothalamic suppression. Forget about the last 2 words I mentioned, but just focus on stress, right? Stress. We talked about stress yesterday. What stress will do to you in your fertility journey? Stress. At least this one you can control. This one you can manage by yourself. So stress can suspend ovulation for you. So when are you going to start managing your stress? When are you going to start doing something about the stressors in your life? Right? Do something about it. Right? Then the last one is those who are at their perimenopausal phase, because you are close to menopause. I'm just talking about you, right? So all these things I mentioned can cause an ovulatory cycle, even though there is bleeding. So do not be deceived. You need to get evaluated, right? No egg is released is equal to no pregnancy, no matter how regular sex is. So long as egg is not released in ovulation, so long as there is no ovulation, forget about pregnancy. And I just mentioned the conditions where you can have that. Is it clear up until this point? Up until this point, is it clear? Just talk to me in the comment section. Just type clear. Right? If it's clear, say clear. Then let's go to the next reason why you can have regular sex and no pregnancy. So we've dealt with reason number 1. Now let's talk about reason number 2. Yeah? Reason number 2 is ovulation is actually happening, right? Ovulation is actually happening. But you know what the problem is? The timing of sex is over the bar, right? The timing is off. The timing is off, right? But understand that ovulation can shift month to month. And I said that in the last 2 episodes, right? So I'm just adding to what I've said. Ovulation can shift from month to month. I gave that as a reason before. And one of the cause of this shift will be stress again. Stress can either shift it, delay it, or suspend it. And I'm hammering on stress because it is what you can control by yourself, right? Ovulation can occur earlier or later due to stress. They're so stressed out. We live in a day and time where everybody's hustling. We want to make this money, right? Plus the stress. You do a business that is stressful, job that is stressful, and you're even a traveler. Traveling also can suspend, and so can shift rather ovulation. right? It's not always 14 days before the next menstrual bleeding. It's not always so. But the standard is 14 days before the next menstrual bleeding. But it's not always so because of these factors that is affecting your life, right? If I ask here now, how many of you can tell me in the past 1 month you've had 7 to 8 hours sleep consistently at night, right? B, you need to see your doctor, right? See your doctor, get evaluated. Is that okay? Okay. So I said all that is to say that your calendar your calendar assumption may fail you if you don't know these things I just mentioned. If you're keeping the calendar, this is when I'm supposed to ovulate. Or even not even calendar, there's this thing you guys have. There's an app, right? There's this app, people, yeah. So the app may be speaking based on your calendar timing, but the factors in your life is shifting. It's just swinging your ovulation back and forth, right? Studies have shown that over 60% of women don't know or misidentify their ovulation timing. 60%. That's more than half of women in their reproductive age. They misidentify ovulation timing. They may have known it correctly before, but other factors are now playing to shift it back and forth, right? So if you are using your app, the app is good, but add this knowledge today and understand what could be happening. Do you understand? Do you understand? If you understand, just type understood so that we know we are together. So when you are trying, good evening, Queen Love. When you are trying right, it means you require biological confirmation and not guesswork. You need to have biological confirmation that you are actually ovulating. And I'm sure I'm going to tell you guys, not today, because I'm actually on a timetable. So I'm not going to rush anything. Just follow me slow but steady, step by step, episode by episode, and we are going to get there, right? I'm going to tell you how to identify the ovulation, right? So we can work together on that. All right. Let's go to the number 3 reason. If you're just joining, you're welcome. Please make sure you tap on your screen, share the live. The likes is not going up. We are not reaching more people. More people are still crying in their homes because they are trying to conceive. And we have all the answers. Is it fair? Just tap on your screen so that at least we can reach them. Right? So number 3 reason why you can have regular sex and 0 pregnancy. Right? Number 3 reason. Sperm is present, but it's not functional. Queen Love, I see you. Good to see you. Queen Love, I see you. And by the way, those of you that are asking questions, I will get to your questions. Just exercise some patience. Learn something first. Is that okay? Learn something first. More likely, I would have even answered your question before we get to Q&A. So calm down. So number 3 reason is sperm is present, but not functional. Is it possible that sperm is present and the sperm is not functional? You know, in episode 2, I told us that you can release 1 full gallon of semen and yet it's not adequate for fertility. So it's not because you ejaculate one plenty thing. No, it does not work like that. Right? It does not work like that. A man can ejaculate regularly and still have low sperm count. With the regular ejaculation, he can still have poor motility. What is motility? Ability to move. And I've always said that the tendency, Saronia, how is the baby? How are you? Good to see you. How's the baby? What's the baby's name? You guys should be telling me this baby's name, so that I can also feel like a father too, right? All right. Where was I? Idrissa, that's nice. Beautiful. All right. So I said this. I said that a man can ejaculate a river. Oh no, I did not say a river. A man can ejaculate regularly and still have low sperm count. A man can ejaculate regularly and still have poor motility, sperm motility. What does that mean? Motility means the ability for sperm to move. And the tendency of sperm is to move forward, because there are sperm that are moving, but they're not moving forward. They're just moving, they're just all over the place. They're not moving forward. But a sperm that will deliver you the results you look for is the one that is moving forward. Agile, active, and forward looking. Right? So if it's having poor movement, is slow, forget about it. So that is a factor. And sperm that, of course, a man can ejaculate regularly, but have abnormal morphology. What is morphology? Morphology means appearance of sperm. There is a way sperm should look. It's not because it was ejaculated, therefore it is the correct sperm. No. They are poor looking sperm. Right? They are poor looking sperm. A sperm must have that configuration. And that configuration is designed in such a way that when it reaches an egg, it must fertilize the egg. Ability to move forward, having its tail moving spirally. It has a neck, and it has a head that is shaped in a particular way. The head must not be round. The head must not be half head. It must not be pin head. Yeah, it must not be two heads. It must have the correct morphology. So, regular ejaculation, abnormal morphology, forget about pregnancy. And a man, right, age and some other substance use, right? Is that okay? Now, male factor contributes 40 to 50% of infertility in this journey. So it's not women business. It's not, oh, woman, go and check yourself. After all, I have two baby mama. No, it does not work like that. As far as this fertility race, this particular one, not the baby mama one, this one is concerned, you contribute 50% or 40 to 50% of the problem. Reason why you must be evaluated. Yeah. You know the unfortunate thing, even with this knowledge, many men often delay testing or even skip testing altogether. There's only women that's always at the front, always at the front, always at the front. Okay, now that you have gone there, everything is all right with you. What else do you want us to do? That's why you need your partner. 50-50 chance. We're all contributing to this business. So I said all that to say regular ejaculation is not equal to fertile sperm. So what constitutes a fertile sperm? Sperm count must be adequate. Sperm motility, normal morphology, and sperm quality. Now, understand that most of the reason why sperm quality, quantity, and all these things happens are defective. Most of the reasons why they are defective, those reasons can actually be removed, and the problem is reversible. For example, smoking and alcohol affect sperm quality. Substance use affects sperm quality. Stress affects sperm quality. Poor nutrition affects sperm quality. General lifestyle. So if men would change any or all of these things I just said for the better, the case can be reversed. It can be reversed. So that is why that makes it very hopeful, right? Makes it very hopeful. Anyway, that is the third reason why you can have regular sex and no pregnancy. If upward to this point you understood anything, type understood. Let me be sure you are still here. Who is still here with me tonight? Oh boy, let's go to the fourth reason. Who is still here with me tonight? Let's talk about the fourth reason. All right, fourth reason why you can have regular sex but no pregnancy. The tubes are blocked or they are impaired. Blocked tubes. As the case of a few people that we have seen in the past days, right? Even with perfect timing, even with normal ovulation, even with good sperm, fertilization cannot occur if the fallopian tubes are blocked. Listen, you have a perfect timing. You have normal ovulation. The sperm quality is good. Fertilization cannot occur if the fallopian tubes are blocked. Because fertilization actually occurs in the fallopian tube. This is where the sperm and the egg meets. That's where they meet. Fertilization meets there, happens there. But now the fallopian tube, where the action happens, is blocked or even impaired. If the tubal motility is impaired, what does tubal motility means? For those who were here in the first season, I talked about the gentle peristaltic movements of the tubes, right? Shiro, go and see your doctor. They will help you with the medicines, right? Is that okay? So if tubal motility is impaired, that's another problem. Why? What is the purpose of that movement of the tubes? Is for propelling of the egg towards the sperm that is coming in this direction, right? If excuse me, if inflammation prevents sperm from meeting the egg. Inflammation, there could be inflammation of the tubes or tubal inflammation. And if that happens, it impairs or restricts the sperm from finding its way in the direction of the egg. Right? And the common causes, I'm sure you are really interested in what can cause this. Right? What can cause this tubal blockage or impairment? What can cause this? Very simple. Past pelvic infection. That's why you see, if you have signs of infection at any time, go straight for treatment. Don't wait. Don't wait. Because waiting is dangerous. It's you that have fallopian tube. You are the one that should be worried if you really want to have children in this world. Don't wait. All right? Past abortion. Past abortion. I will not say more. Past abortion or past surgical adhesion, right? Due to scarring and healing, there could be adhesion that would occur. So that can cause these tubal impairments. Yeah. Endometriosis. So sex can be perfectly timed and still it is ineffective. Mr. Tabs is here. Welcome in, Tabs. If you're just joining, you're welcome. So I said sex can be perfectly timed, but yet it can still be ineffective because of these factors. The fallopian tube is either blocked or impaired for the reasons I've given. Right? That is reason number 4. Who is ready for the fifth reason? Who is ready? Talk to me in the comment section. Greetings, people of God. Mr. Taps, thank you for coming. Who is ready for the fifth reason? Why? The fifth reason why you can have regular sex but no pregnancy. It's really concerning. So we're answering your question tonight so that by the time you wake up tomorrow morning, you begin to adjust some things. The ones that are in your hands, you can control. The ones that you cannot control, go and see your doctor. Is that okay? If you're just joining, you're welcome. If you're not following me yet, follow me now. Right? And if you've missed any of my episode since we started the season, go to Facebook, search my name, Dr. Godwin EMB. You will see the videos there. Make sure you subscribe to me. Please subscribe. Right? And those videos, they're going to bless you. And I tell you, if you don't want to get pregnant, don't look at those videos. Because if you look at it long enough, you will conceive. Right? No joke, you will conceive. All right. Reason number 5 why you can have regular pregnancy. Regular sex but no pregnancy. All right. Regular sex but no pregnancy. Reason number 5. Fertilization can occur normally. Right? There was ovulation, the sperm quality was good, there was fertilization. But what happened? It fails to implant. Implantation failure. There is implantation failure. And this is one of the most silent reasons for this infertility we have been dealing with. Implantation failure. Fertilization took place quite okay. but it just will not implant. What happened? Now remember, if fertilization occurs, it means that an embryo began to develop. True? Yeah. Because the moment there's fertilization, embryo begins to develop. But the embryo that is developing needs to implant to continue its journey as a baby. So if for any reason it cannot implant, that pregnancy will fail totally, because there needs to be an implantation for a baby to continue forming, right? And this failure to implant can occur due to the following reasons. Now, this is where you need to grab a pen and a paper if you have not been writing. This is where you need to grab a pen. I will slow down here so that everybody, one of the questions somebody's going to ask me today. So let me quickly answer it. Right? Innocent. What you are asking is what I'm about to discuss. In fact, that's what I'm even discussing. So pay attention. And if you've missed the earlier part, please go to YouTube, search my name, Dr. Godwin EMB. Subscribe. Watch all those videos there. It will change the way you see your fertility journey. I tell you the truth. So who's ready? Are we ready? Have you grabbed your pen, your paper? Let's give you some information that will change the course of your fertility journey, right? Implantation failure is due to, number one, thin or poorly receptive endometrium. What does that mean? Your uterus has three layers. The outer layer. Christy Lebel said, my pen stopped writing. Your pen should not disappoint you at this time. Good evening, Temi Cool. I see you. Right? So your uterus has three layers. The outer layer, the middle layer, and the inner layer. The functional part of the functional layer is the inner layer, because all the blood you see every month is coming from that inner layer. Good. Now, after menstruation finishes, under hormonal influences, the inner layer begins to develop again, because what the body is saying to your uterus is, prepare. In few weeks' time, we are likely to implant a baby. Right? If you're just joining, you're welcome. Gambo, I see you. Right? So your body is telling your uterus, prepare, where you should be expecting a baby in a few weeks' time. So what happens? The inner layer is being developed, just like you plow your soil before you plant a seed. So that's what is happening. Blood supply, nourishment, glands, everything. It's just every resources is channeled to that place. Right? It should be thick and rich enough. Remember, you cannot sow seed in a shallow ground and expect growth. No, the same thing with the uterus. It cannot be thin. It cannot be thin. Even if it is not thin, it should be able to receive the seed. You understand? So the number one reason why implantation can fail is thin endometrium or poor receptive endometrium. And this is one of the things that they check in your fertility ultrasound. And it's one of the things they give you some of those drugs for, especially progesterone, to help you taking it, right? That's the first one. Number two, implantation failure can be due to fibroids or polyp. If there is fibroid within the inner layer, now go to my videos on my profile. I've done some videos about fibroid. Go and learn, go and learn, go and learn, right? So if there is fibroid in the inner layer, that the presence of that fibroid can negate implantation, because where will the embryo implant? Where fibroid is occupying the space? Or polyp? Polyp is a growth, right? So fibroid or polyp occupying the space where implantation is supposed to occur. So that is another reason for implantation failure. Remember, fertilization has already taken place. So effectively, you can happily say, my baby is forming. But unfortunately, it's not going to progress because implantation failed. And the failure is due to thin endometrium or poor receptive endometrium, fibroid or polyp, or adenomyosis. I've done video on this again, so I don't want to buttress it too much because there's already a video on my page. Go and watch it. Adenomyosis, right? Adenomyosis. Triple kids. Go to my videos. There is a video I did on blighted ovum. Watch it. You understand everything to your question. Is that okay? Reason number 4 why implantation can fail. Hormonal luteal phase defects. Hormonal luteal phase defects. Just simply put, hormonal impairment. Leave the grammar alone. Just understand the concept. The easiest way to understand anything is just to understand the concept, right? Because nothing is difficult in this life, whether it's aeronautics, whether it's space science, whether it's agriculture, whether it's economics. Nothing is difficult. Well, most of the time we were taught in school to focus on the grammar. No, focus on the principle. If you can catch the principle, apply it, and so nothing is difficult at all. And of course, because you are not so. If I want to, no, let me not cast updates. All right, and the last point I want to give you on implantation failure is chronic endometrial inflammation, like you see in endometritis, inflammation of the inner layer of the uterus. So these are the reasons why implantation can fail. So what do? You want to make sure you are evaluated. Go for checkup, right? Go for checkup. All these often will present themselves if you can have a regular cycle, right? You can, with all this, you have no obvious signs of pregnancy, no missed period. Why? Because all these things are standing in the way of implantation, but yet fertilization keep happening, but just that it does not implant. If this is your case, make sure you go back to your doctor, get evaluated, and know which one is your problem and solve it, right? And solve the problem. So that is number 5. The number 5 reason why you can have regular sex but no pregnancy. Number 6. Are we making progress? Talk to me. Come on now, talk to me. If we are, Akua Otiwa, I see you. Number 6. Let's talk about number 6. If you're still here, please make sure you're tapping on your screen. Number 6. Number 6 reason why you can have regular sex but no pregnancy. You're having either egg or sperm quality is low. Egg or sperm quality is low. Yeah. And you need to understand that quality matters as much as quantity. Right? This particular aspect of the gist becomes worsened or increases with age. As your age increases, egg quality decreases, sperm quality decreases. What did we say? Egg quality begin to depreciate from 35. It doesn't mean that you don't have hope, but just know that the chances is not like when you are 25. Right? Sperm quality begin to depreciate from 40 years. What is the depreciation is not as fast like that of egg, right? Okay. So egg quality declines with age. Chromosomal error increases with age. Embryo ability to survive reduces with age. That is why older women suffer miscarriages more than when they were young. That answers the problem, right? Silver blockage, please go to your doctor and see what they can do about it. Is that okay? Otherwise, consider IVF. Is that okay? Now, with respect to men, oxidative stress damages sperm DNA, right? Lifestyle and environmental toxin play another major role in sperm quality. Lifestyle like what? I talked about smoking, talked about alcohol, excessive intake of caffeine, right? And poor nutrition play a serious role. So fertilization may occur, but the embryo will fail early. Age is the reason why most older people have miscarriage more than younger people. Why? Because according to the quality control system of the body, if a poor sperm meets an egg or a poor egg receives a sperm and a poor embryo is formed, the quality assurance system looks at it. Can this amount to a healthy, successful pregnancy outcome? If the answer is no, the body terminates it. So sometimes it's not like something was wrong with you. It's just that the body just senses that this is a poor specimen of a human being. So it takes it out. That is biology. Darling Bliss, you have a lot of supplements to take, so you can enjoy that one. All right, if you're just joining, you're welcome. I'll answer all your questions when we are done with our gist, right? I'll answer them. Then if you have missed any of the episode, because some of you are seeing me for the first time, go to YouTube. All the previous episodes, the 4 previous episodes are already there, right? So just search the name Dr. Godwin EMB. Subscribe, like, and share. That's the only thing you can do for us to reach many more people that are trying to conceive. Just imagine the one person you will share this to, and the answer to her problem is just in that video. Think about it. Think about it. All right, let's go to number 7 cause. Number 7 cause. Right? Number 7 reason why you can have regular sex. Regular sex. All these questions. All these questions people are asking. You need to pay. You need to pay. You need to pay because when you're ready to pay, come to my DM, right? Or subscribe. Look at subscription up there. Tap on subscription. Subscribe and come. Right? And by the way, if you are subscribed to me, I can always have a consultation with you anytime, any day of the month. That is your spec. That is subscriber spec for you, right? So just subscribe. That's the only way I can help your life, CC. Subscribe. So that we can work together. Reason number 7 why you can have regular sex. I don't understand what you're saying. Hawa Otiwa. Explain, let me know. All right. Why you can have regular sex but no pregnancy. Number 7. There is the unexplained cause, right? Idiosyncrasy. In the idiosyncrasy. If you have tried to subscribe, it's difficult for you, hit my DM. Tell me it's difficult. Then I'll give you another option. Is that okay? So the unexplained aspect, that it is unexplained, does not mean that nothing is wrong. It's just that medically we can't just figure out what is really wrong, right? About 10 to 20% of infertility cases are labeled unexplained. 10 to 20%. We have evaluated you. Everything looks okay. You and your partner, okay. We just can't. What really is wrong? That is unexplained infertility. Idiosyncrasy. Right? Well, it doesn't mean that nothing is wrong. It's just that we cannot find it out yet. Is that okay? So you just keep at it or get second opinion or get a different opinion. Is that okay? All right. And by the way, unexplained could mean that the couples, there's some health challenge with the couples that we cannot figure out. It could also mean that stress is the cause. It could mean stress. Anything could have happened, right? So it's just that we just cannot detect the problem now, right? Because you need to understand that biology is way ahead any diagnostic tool that we have developed. There was biology before we came. Before we started this technology, there was biology. So we're just trying to figure out every day new things, right? By the way, I hope you know that if I saw on the news the other day, they have created AI wombs. So if you don't want to carry baby, just the AI womb will carry your baby till they are ready. Is that not funny? That is really funny, right? All right. So I think let's take some questions. I want to stop here. I want to stop here. So send in your request if you have a question. Let's answer your question before we go. But don't forget, go to YouTube, search my name there, Dr. Godwin EMB, subscribe and watch the previous episode, and it's going to bless you. All right. So this episode we have discussed tonight is not saying that you need IVF immediately. That's not what we're saying. It's not an automatic need for IVF, right? It's also not saying that something is terribly wrong. That's not what he's saying. He's not also saying that natural conception is impossible. That's not what he's saying. What he's saying is you deserve answers. And that is the answer I'm bringing to you tonight. He's saying that biology should be checked. And that is why those of you that are asking me which drug, that drug. If you notice, I don't talk about drugs or medications on my live stream. My job is to help you figure out the biology, right? Your doctor will give you drugs. But I feel like you need to understand first before you start troubling your system to produce results. What if you are just trying to force water out of a dry orange, right? Be smart, right? So, but long story short, infertility, when it comes to fertility, precision will beat persistence. So it's not because you have irregular sex. No. The question is how precise is your fertility strategy? Yeah? All right, let's take one or two questions before we begin to go.